Oh, welcome to Boomers Today. I'm your host, Frank Sampson, and of course, each week we bring you important and useful information on issues facing baby boomers, their parents, and of course, other loved ones. We have another great show for you today, and we bring you these wonderful shows each week because you're asking for them. Our listeners are growing each and every day, and I want to thank you for that. So many of you have, listen to it. You could go to our website at boomerstodayradio.com. But I would have to say most of you are listening to it right on your phone, on your walks in the morning. That's what we're hearing. And we thank you for that. So you can, of course, listen to the show on our app, Boomers Today app that you can get on your iPhone or Android phone. Of course, on Google Podcasts, Apple Podcasts, Spreaker, Stitcher, iHeartRadio, many other apps, pretty much all of them that are on that you could find online. So, again, thank you. And our listeners are growing also because we have such great guests. And we're not going to let you down today. We have with us Ben Rayo, who is a lifelong entrepreneur, philanthropist, and senior care advocate who lives in Lee's Summit, Missouri. Ben has published a book called Paying for Long-Term Care, which offers a comprehensive roadmap for families transitioning a senior into long-term care. Ben, I was really looking forward to having you on the show, so thanks for joining us.
Oh, Frank, thanks so much for having me. I appreciate that.
Yeah, no. So I went through your book. I kind of speed read it, but just a wonderful book, and we'll share with everybody how they could get that shortly. But I just, we're both of us are in this industry and dealing with a lot of issues with families. And it's always quite interesting to me, and I love to get your thoughts on it. That one thing we do know that we got 100% surety that we're going to die. I mean that's for sure. I mean I haven't heard anything different than that. But you bring up a very interesting statistic in your book that it shows that once you turn 65, you got about a 70% chance that you're going to need some sort of long-term care. So since those odds are pretty high, certainly not 100% like death, all right, what are your thoughts there on how we could best educate people to kind of plan a little better than maybe you and I both experience what people are doing? Any thoughts there?
Yeah, I mean, it's kind of frightening to think about the lack of planning that people have when they're thinking about long-term care and what's going to happen as our family members get older. You know, everybody knows about the silver tsunami and the big wave of baby boomers that are coming towards us in the United States. And 70% of those people that reach the age 65 are going to need some kind of care. We have a lot to do here very quickly over the next 10 to 20 years in the United States. And a lot of us are just not prepared as families because we're just simply not having the conversations we should be having. We're not talking about it because nobody wants to talk about when they have to put their parent or loved one into some kind of level of care, or nobody wants to talk about planning for death. Nobody wants to talk about planning for some time when your loved one's going to be very sick and have to go somewhere, whether that's memory care, assisted living, for the last few years of their life. So, I'm soon to go on a vacation here, Frank, and I put at least 15 to 20 hours into planning for that vacation, but I haven't had 15 hours of conversation with my mother.
Right. Yeah.
About what her wishes. And I think people don't want to have those conversations because they feel like they're going to upset their family member. And it really needs to come from the approach of, hey, I want to have this conversation with you because I want to make sure that I'm following through on what your wishes are. I want to make sure I know what's going to make you happy. And I don't want a bunch of extra stress as the son or daughter of a parent, and they just need to understand. I had somebody say something interesting a few weeks ago. They said, I used the book to talk to my parent and I just blamed it on Ben. So now it's starting to get this thing. It's like, hey, the book becomes a platform to say, it's not me, mom or dad. blame it on Ben. It's the book. They're saying this is what we need to do. This is what we need to plan for. Getting into the senior living industry several years ago, I really started to see how big of a mess it is for families because just nobody's prepared for a loved one to go into long-term care. They're not prepared emotionally. They're not prepared, especially financially. 6 or 7 years ago, I talk about it in the book, my stepfather, Tom, got sick very quickly, and we tried home health care. We tried that, and it just wasn't going to work. And we quickly saw, even in 90 days, that we're going to have to do something different. So I live in Kansas City. I grew up in Louisville, Kentucky, so he lives there. Very typical for the adult child to live over 400 or 500 miles away from where their parents are.
Right.
So now I'm trying to figure out, what am I going to do to find an assisted living community somewhere 800 miles away when I don't even know anything about it?
Yeah, it's so based on what you're saying, it's your feeling that families probably are not prepared, both emotionally and financially, or are they? For the kind of what the road ahead.
They're not at all, and part of it's because they're not having a conversation. So I'm not a real sophisticated guy, so I laid this book out to make it really super simple to try to get families from knowing nothing to at least let's get them to 50% of the way there. We're not going to get into a bunch of clinical stuff in there. It's just a really simple roadmap that starts with, how do we figure out what level of care that the senior needs? And we have an assessment tool on our website that's a third-party product on payingforlongtermcare.com that allows them to go through a questionnaire and kind of understand what level of care that their loved one may need. And then at that point, kind of step 2 is, how do you figure out what assets the family member has? A lot of people want to skip those 2 steps and go straight to start Googling to look for an assisted living community. And that's really not the first place to go. We need to understand what assets we have, so then we can start figuring out how we're going to pay for it. That third step is how we're going to pay for it. Is it Medicaid? Is it retirement? Is it from a 401k or an HSA, or is it from long-term care insurance, or do they need to sell the house, or what are going to be the different ways that they can pay for care?
Yeah. How many times have you heard this question? Doesn't Medicare cover that?
Even better. Yeah, doesn't Medicare, right?
Right.
People just have no idea. I have Medicare. Well, you don't know what Medicare is then. And that's not uncommon. It's complicated between Medicare and the supplements.
Why don't you explain that, since we're on it? There might be people listening going, well, yeah, doesn't Medicare cover it? So why don't you explain that?
I'll start with that. Just disclaimers that I'm not a Medicare advisor. I'm not an attorney. I'm not a financial planner. I'm not a doctor. But I like to keep track of it in my mind to say Medicare is healthcare, and Medicaid is what would pay for something like long-term care if someone's going into long-term care. Now, for Medicaid, you need to be pretty much broke. I mean, you have to be poor to qualify for it. And understand why the government wants to do that. They don't want people to have money to be taking benefits from somebody else that doesn't have any. Medicare turns 65, and that's available there for you to help cover some of your health expenses for people. And then the supplements are things that you can go out and buy from third-party insurance companies to go add on. So if Medicare is only going to cover 80% of the cost, then you can go buy supplements that would cover the other 20 and pay those. No different than having your high deductible type stuff that you would have with a normal insurance.
Yeah, right.
That's the layman's explanation.
So what, I don't know if we don't necessarily have to be getting into different types of policies and things, but when anytime you mention long-term care insurance to somebody, reaction is, oh, I heard that's so expensive. Now, I know that there's different types of programs out there where they combine kind of long-term care with, with life insurance, long-term care insurance. And again, I know that isn't necessarily what we were going to get into, but I think it's important for people to understand there's a lot more options out there, aren't there?
There are. And so that was part of it. The book is Paying for Long-Term Care. And so it's really to try to help people understand what the different financial consequences and financial options are to pay for care. But again, as we go through kind of a roadmap that we built, that there are a lot of things. What I'm hoping, Frank, that we can do is we can impact a lot of families, and we have people that are in their 40s, 50s, and 60s that have family members that they're going through this now, where they have a loved one that's gotten sick or can't live at home anymore, and they transition them into an assisted living. So there's a lot of different ways. And if we can catch people early enough in the cycle, there's still time to save money. There's still time to possibly get a long-term care insurance policy. A lot of things with Medicaid. If you have a house and you sell it, they're going to look at that as an asset. But if you have a house and you put it into a trust and it seasons for 5 years in a trust, then it's no longer going to be considered an asset. And so if I've got somebody that's in their 70s, that's a family member, maybe we want to consider putting that into a trust. So then it doesn't get counted towards all that. A lot of times that the house is the largest asset that somebody has, and many times people need to sell that asset to pay for care.
Yeah. Well, I know you were mentioning about it was your father-in-law, right?
It was my stepfather.
Your stepfather. Okay, I'm sorry, your stepfather.
Yeah.
Maybe you could provide a little more information. As you know, and you and I met in our industry. We're both in the industry, and my day job, of course, is we help families and guide them, and how to transition into senior care, more assisted living, memory care, things like that. That's kind of our specialty. But I know you probably deal with this situation quite often too. But any thoughts you have as far as best way to guide people and navigating that transition?
Well, I think the best advice I could give is if a family's at the point where they know they need care and they kind of have the money thing figured out, because you can't go get care because you don't know what you can afford, right? So that's why we say you got to calculate all your assets, and then you start looking at how you're going to pay for it. And now you're ready to say, can I afford a care community that's $3,000 a month, $5,000 a month, $7,000 a month? How am I going to pay for that? But I would always recommend working with somebody that's a senior care advisor, a placement agent, a geriatric care manager, somebody that really understands navigating the senior living industry to help be the best matchmaker for the family to find the best level of care, the best option of care. A lot of people don't realize that there's people out there, placement agents, that actually have relationships with care communities that can go out and really understand what the needs are of the prospective resident and really be a great matchmaker to find out this is the best place for you to go based on what your needs, wants, what you enjoy doing.
Right.
Working with somebody locally is going to know those care communities much more than somebody that's working remotely from some other city, state, or something else.
Exactly. Yeah. There's so many different other industries where people rely on the professional, whether it be in real estate or financial planning or insurance or whatever, or legal, they're going to go to a professional. I think that because this industry, in a sense, is so new, people don't realize that there are advisors out there to help them with that type of planning.
Yeah, and if you're listening and you've not heard about an advisor or a placement agent, it is no different than the real estate space. It's a buyer's agent. The resident that's moving in is the person that's going to be buying a house. The placement agent is the person that's representing the buyer and helping them to find the right house that they want to buy. And the care community is the house that they're buying or moving into. And the best thing the families may not realize is it doesn't cost the families really any money if the care community is going to be paying the fees back for the services of the placement agent.
Yeah.
Did I say all that right, Frank?
No, you were great. You're perfect. Right. You're perfect. So, I do. We're going to take a real quick break here, Ben. I just want to recognize our sponsor today, and Then we'll come back and you could share with people how they could learn more about your companies as well as your book, and we'll talk about multi-generational impact, a lot of different things. We'll be back in 30 seconds here. So I just want to remind everybody that today's show is sponsored by Senior Care Authority, an elder care consulting organization that has a national network of professionally trained and experienced local advisors to assist families in determining the right path for your loved ones. They'll discuss various long-term care options, whether it's in-home care, assisted living, memory care, nursing, or if you just need an advocate to get advice from, a local Senior Care Authority advisor can help you now. So for a free 30-minute consultation with an advisor in your area, contact Senior Care Authority at 888-809-1231, or you could go directly to their website at www.seniorcareauthority.com. Click Find a Local Advisor, and you'll get connected with somebody today. We're back with Ben Rayo, who is the author of a new book that just came out, Paying for Long-Term Care. So Ben, tell us more about the book and how people could get it, and it's commercial time.
It's commercial time. Okay,
Yeah.
so payingforlongtermcare.com is the website, and you can go to that website and you can buy the book. We've had a lot of excitement from people with the book. We've hit bestseller in 4 different categories on Amazon. Not something I expected to do. You know, I wrote the book to really kind of help families, but people are finding it, and they're finding it's just a really extensive guide to give families, to let them know what they should be thinking about, whether it's now. I mean, if you've got somebody that's over the age of 50 in your family, this is a book for you. So you can buy that on Amazon. You can get it at payingforlongtermcare.com. There's both hard copy and electronic copy. It's about 170 pages. It's loaded with all kinds of different tips on the payingforlongtermcare.com website. There's also about 20 different resources that are free. So there's downloadable guides as far as how to compare care communities, how to make your house safer for the senior. You know, one of the interesting things, I guess there's a lot of interesting things that I've learned over the last few years, and then doing a lot of research for the book. You'd be amazed at the number of people that are veterans that don't realize that there's a program called Veterans Aid and Attendance.
Right.
It just blows my mind. This is a great resource, and this is just one way to pay for care. But if you've served an active war, which we show all the different wars and conflicts on the website there, you could qualify for. Usually it's around a few $1,000s to help pay for either in-home health or long-term care. So it's there's great resources there.
Even more so on that same subject, a lot of people don't realize that there's benefits for the surviving spouse veteran.
Yes.
So if the veteran has passed and the spouse needs care, surviving spouse, there's benefits there too. So that's a great point.
That's a really good point, Frank, because I think I can see how that one gets lost. That one can get lost because my spouse died 10 years ago. They served in active war, and now, usually it's the woman, because they live longer, is the one that's left behind, and the spouse, passes, and they don't even think that that's an option. That would have been for my spouse, not for me. So that's a good point.
Yeah.
Another area that's really creative, because I try to put together a lot of different creative ways that people could help pay for care. One of them is, a lot of people don't realize there's about $30 billion in trust funds sitting on the sidelines that are going to go away in the next 3 to 7 years. And these funds are set aside for people that were exposed to asbestos. And so people that had, there's a lot of industries that had products and services, and workers were exposed to asbestos during that manufacturing process, or if it's drilling or coring or different jobs. Even a lot of veterans, because you had aircraft carrier plane brakes were, high heat, and so they had asbestos there, and all that dust came off. But it takes about 30 to 40 years for this to manifest itself. These trust funds are sitting there, and so we put a partnership together with a national network of attorneys that specialize in that will take somebody through a quick survey on our website, and if they make it through that, then we'll just make the introduction, and they can work with those different firms. And the thing that's really neat here is that the families don't have to go to court typically. They just do a deposition over the phone. the attorneys gather the information, and depending on what level of exposure, and if you've been diagnosed with lung cancer or on the high end mesothelioma, there's a lot of money sitting there that you just qualify for, basically. And it's not like people think that they have to go to court and go fight the big companies. It's a lot of money. It's there, and it's going to go away. Here in another about it kind of depending on the different funds, they expire at different ages. So that was one way that we put together to help people to pay for care that they may not be thinking of.
That's a great point too. I mean, that's something most people don't know. So thanks for bringing that up. That's great. So yeah, you gotta get this book. It's a great book. I took a look through it, and it's certainly very, very informative. And it's a quick read. So let's talk about kind of the multi-generational impact there will be in planning for senior care. What are your thoughts there?
So if you're not familiar with how much it costs for care, it can be very expensive. It could range from, what you don't want to do is you don't want to live in Alaska. I think Alaska is like one of the most expensive places to pay for care. It could be upward of $400,000 a year. But here in the Midwest, where I am in Kansas City, it could be $40,000 to $60,000 conservatively. If you get to DC, you get to New York, you get on the coast and some other larger metropolitan cities, it could be over $100,000 a year for care. And the impact financially downstream can be huge. If my mother worked in the non-for-profit space for her entire life, and so she was a planner, and she knew she needed to have long-term care insurance. She's got an amazing policy, and it pays like $12,000 a month. And I'm like, yes, that adds a lot of security for both me as her son and for her to know that if she needs it, she's got money there. Without that, if we need to go find $200,000, $300,000, $400,000, that's a financial ripple effect downstream, and we've got to figure out how to go pay for that. Otherwise, we're going to have to go somewhere that's more of a Medicaid, which is much more of I'll say, it's more institutional type of a feel versus, a private pay, which means you've got some other way to pay for it besides the government. And those private pay are more amenities, the chandeliers and those type of things. So, from an educational perspective, what I'm hoping is that we can educate the adult children and people to say, this is coming. I heard somebody say this is really funny. It's like, hey, you're going to get into senior living whether you like it or not.
Right.
At some point.
Right. I say to people, you brought up at the beginning of the show about the silver tsunami, which a lot of people have heard. Certainly people in our industry, the general public may not have heard that term, but the silver tsunami. And I say, it's just sprinkling rain right now. It's just in the skies are starting to gray. That's how early we are in this process. Yeah. It hasn't hit.
When we talk about that, and I know a lot of people think the silver tsunami has a little bit of a negative connotation, and I don't mean any disrespect when we talk about it. That's just an industry term that's come up. But what it really means is that we've got this huge wave of baby boomers. When the war was over in the 40s, and everybody decided they were going to get busy when they got back because they missed each other. It created this huge wave of seniors that are coming at us. So, by I think the number's 2030. Maybe 2040, but we're going to eclipse that 20% of our population is going to be over the age of 65, which is a little bit scary. The other scary part, Frank, is that about 20% of our population is going to be under the age of 18. So now we have 40% of our population that needs to be taken care of by the 60% that is going to carry all the heavy lifting for our economy, for our country. There's an impact just with that. Aging in place where you're able to stay at home and not necessarily go into a care community is something I think we're going to have no choice but to see a shift. I don't know if you saw that article that Biden did. It was a couple of weeks ago about a $400 billion package about the possibility of starting to pay family members to take care of or do in-home health or and rewarding them in some way. It seems crazy. It seems
And
crazy.
I'm based in California. They're looking at things in the state of California to help as well. So there's a lot of that going on. Yeah,
The
it is.
government's acknowledging that we have some challenges ahead of us. It's, we've got a challenge that we need caretakers. We have a challenge that we need physical beds.
Yeah,
And
yeah,
we're gonna and that group of people, that the baby boomers and their parents, which many of the baby boomers now still have parents that are alive. That whole demographic of people between those two groups, baby boomers and their parents, probably own between 35 and 50% of all of the real estate in the United States.
yeah,
So all of these houses are, that are going to be coming onto the market. And the house and all the stuff is one of the biggest stressors for the families, as that they have a house that they have lived in. Maybe it's grandma clean, but it's got avocado appliances because they still work great. And that generation from the Depression didn't change anything out that they didn't need to. They just took good care of things and didn't buy anything they didn't need to. So now we have a mom that's living by herself. Spouse passed away 6 or 7 years ago. She's been doing what she can to kind of get along. The house isn't being maintained as much as it should be. It's not been updated. And then all of a sudden the adult children get the phone call that mom has to be moved into some kind of full-time care. And the kids live 600-700 miles away. There might be one adult child that lives there locally, and all of the burden is put on the most responsible child, which is, always tends to be the daughter, right? So now we've got this whole process of a family not knowing what to do, being told this. There's been no conversations, and those are some of the things I'm trying to demystify in the book about. If we could just get a little bit ahead of this, just a little bit, just with some really simple conversations. And there's some different downloads on the website and in the book that'll help to have those conversations, because part of that book is about how do we get all the family on the same page, and how do we get together for the transition to long-term care or full-time care.
yeah. This has been great, Ben, and congratulations on the book. It just, we really probably maybe 30 seconds left here, but maybe you could any particular words of wisdom that you want to share with our listeners.
You got to find the courage to have the conversation with your parents, loved ones, grandparents, even if you just start with understanding what their assets are. And then you need to be kind of being self-reflective about, like, how is this going to impact me as I get older, and what can I be doing to plan for this so I don't put a huge burden downstream on my family.
Great. Ben Rayo, thank you so much for joining us. Check it out, payingforlongtermcare.com. Pick up the book. Very educational. So, Ben, thank you so much for joining us on Boomers Today. Really appreciate it.
Frank, thanks so much for having me on. Humbled to be your guest, and I really appreciate you helping to get this message out.
Yeah, thanks for all you do. I really appreciate that. And thank you all for joining us on Boomers Today. Be safe. Talk to everybody next week.